Hello friends, this is Dr. Hema, MD in Homoeopathy from Mumbai, having more than 2 decades of experience in treating patients. So today's topic is dengue fever. Recently, it is very much seen in newspapers and media that there is a hike in the dengue cases, and that is why there is a lot of fear which is there in the social crowd. So today I will tell you what is dengue virus. It is also known as dengue. It is normally seen in tropical and subtropical climates, that is Caribbean, South Asian, also in USA, Texas, Canada, Hawaii. So it is very common and it is transmitted by the bite of the mosquito Aedes aegypti and Aedes albopictus. So these are the mosquito types. It is also seen spreading the yellow fever and the Zika virus, which is recently seen. It can be in the children and also of all age groups. In children, normally they are asymptomatic. In other age groups, it could be the symptoms. So let's understand what are the symptoms. So signs and symptoms. So there is three stages in this. The first stage is the fever stage, where there is fever, high grade fever. It is more than 38.5 degrees Celsius, where 101 to 103 degree Fahrenheit. Then there is a stage with this duration is 7 days. In that you are having severe headache, and also there is a pain in the eye, that is in the orbital region. So then you have myalgias, there is a lot of pain, there is a lot of arthralgias, bone pains, muscle pains. It is also known as breakbone fever. There is nausea, vomiting, also respiratory system involves cause cough and some nasal infections. So this is how it goes. And then there is a critical stage. Critical stage is the very severe stage. It lasts for 24 to 48 hours, but there is a bleeding, which is a warning sign for you. If there is a hematemesis, melena, that is blood in stool, or if there is epistaxis, blood in nose, or any bleeding anywhere from the body, if you're vomiting, and if you're vomiting blood, then you need to be very careful. And if there is also a low in the blood pressure, then you have to immediately get your hospitalized and get your body back to the normal blood pressure. It is also known as dengue hemorrhagic fever and dengue shock syndrome. These two are very severe, which involves the vital organs, that is the liver and the kidney failure, and also lymphadenopathy, there is swelling, and there is decrease in WBCs and decrease in the platelet count. So this is 24 to 48 hours, and you need to be very careful about this 1 day, 1 to 2 days. Then there is a recovery phase. Once you pass this phase, the bleeding stops. There is few rashes which are seen, maculopapular rashes on the body. That could happen in dengue, and the vital signs also would recover. So this stage is normally which remains from 3 to 5 days. So recovery is done. And how do you know that you have got dengue? So for that, you need to do a PCR test, a blood test, or you can do a normal NS1 antigen test. You can do IgM and IgG antibody. So these are basic tests which are normally seen in initial infection, which is 5 to 7 days. So if you know once you have got dengue, so please don't worry. It can be completely curable. You just need to be careful with your warning signs, and you need to do this test. You have to be completely rehydrated. That is the foremost thing. Drink plenty and plenty of fluids. I always tell that the first thing is you have to get your rehydration done, because if you are rehydrated, your central nervous system is not involved, and that is the best thing to happen, and that reduces the deaths in the patients. Once you have diagnosed, how do you treat? So treatment is first is you have to do plenty of fluids. You can take a paracetamol, but a red flag that you have to avoid is ibuprofen and aspirin, because it causes bleeding. You should avoid an anticoagulant. So these are medicines which should be strictly avoided. You can take a paracetamol in a high grade fever, and you can use homeopathy medicines which are very, very good. You can use Eupatorium perforatum in the 200 or the 30 potency, which can be used during your fever. There are a lot of symptoms. According to the symptoms, the patients are treated according to the individual symptoms. If the patient is feeling a lot of decrease in water intake, then sips of water. If the person is taking, we give arsenic. If there is no thirst, we give chalcemium. there's a lot of weakness, we give acid first, but definitely the symptoms of the person is considered and the holistic approach is done. But these are the fever remedies. Also there is Carica papaya which is used. There is Tropicana cordifolia. Also these are the remedies which are very good during fever. So it is very important that you use this medicines during fever. So homeopathy also gives fantastic results. It also says that you have to eat lot of papayas. Normally to eat papayas and fruits is to increase your fluid intake. So basic concept is to increase your fluid intake. Also there is dengue vaccinations which are taken in a gap of 6 months. There are 3 doses which are taken. It doesn't give you a complete prevention from dengue, but definitely the symptoms intensity is decreased and the emergencies are decreased. But I will tell you, prevention is the best, friends, because prevention is, there is a whole year where you have only 2 to 3 months which are the seasonal, where there is a mosquito breeding in the puddles or in the stagnant water, or if there is somewhere there is an accumulation of water. So normally mosquitoes gives lot of eggs and the breeding places. So it is important that in those cases around the parks while going, you have to wear something which is a full sleeves, or you can wear full pants. You can cover your face. How much ever possible you can use a repellents. It is very safe to use the repellents in the pregnant ladies also, but you have to be very careful. If the baby is below 2 months, you cannot use the repellents. If you have a case which is diagnosed in the neighborhood, then please try and get the fumigation done. Buy electric racket, or use some agarbattis or whatever which has a smell which can throw away these mosquitoes. Keep the doors and windows closed. Normally it is the timings of the mosquitoes are 6 to 10 p.m. in the evenings and mornings 3 to 5 a.m. So in those timings you can keep the doors and windows closed. Prevention is the best policy, so you have to use this, and just don't be scared of this dengue, because it is completely curable. The platelet counts which are decreased can be increased with the homeopathic medicines, and it is normally self-limiting, so you can be treated at home with a proper consulting a homeopathic doctor, and there are many remedies which have given successful cases. So friends, don't worry and just be healthy and drink plenty of fluids. And if you have any questions, you can definitely WhatsApp me on the number which is flashing on the screen, or you can message me. And if you have any doubts, or if you want to talk to me, you can call on my number which is flashing. And absolutely don't worry, dengue is completely treated. And if you really like this video, please like, share and subscribe for more such videos. Thank you so much, my friends, for all your love and blessings. Thank you.